To treat heat cramps, get the victim to a cooler location. Lightly stretch and gently massage affected muscles to relieve spasms. Give sips of up to a half glass of cool water every 15 minutes. Do not give liquids with caffeine or alcohol. Discontinue liquids if victim is nauseated. Inadequate fluids or sweat not evaporating due to high humidity causes heat exhaustion. Once the body loses large amounts of fluid, less blood flows to vital organs, resulting in a form of shock. To treat for heat exhaustion, get victim to lie down in a cool place. Loosen or remove clothing. Apply cool, wet cloths. Fan or move victim to an air-conditioned place. Give sips of water if victim is conscious. Be sure water is consumed slowly. Give half a glass of cool water every 15 minutes. Discontinue water if victim is nauseated. Seek immediate medical attention if vomiting occurs. Heat stroke is a severe medical emergency that can be fatal if not treated as soon as possible. A heat stroke occurs when the body's cooling mechanism stops working due to severe perspiration until no fluid is available to produce sweat. To treat for heat stroke, call 911 or emergency medical services, or get the victim to a hospital immediately. Delay can be fatal. Move victim to a cooler environment. Try to move them to a well-ventilated or air-conditioned room. Remove or loosen clothing. Try to cool the victim and reduce their body temperature. Try a cool bath, sponging them with cool water, or place a wet sheet over the victim. Monitor the victim by watching for breathing problems.